Welcome back to the Deep Dive. Today we're going to look at an event that it sits right behind World War I in our history books, but it arguably shaped modern life just as much. We're talking about the 1918-1919 Spanish flu pandemic.
And you just can't overstate the scale of it. I mean, especially when you think about the global population back then. This specific strain, influenza AH1N1, it infected about 500 million people.
500 million? That's what, a third of the entire planet at the time?
Roughly a third of the planet, yeah. And the death toll. It's just staggering. WWI was this huge man-made tragedy, and the flu just layered a biological catastrophe right on top of it.
The estimates are all over the place, right?
They are, mostly because of, poor record-keeping during the war. But the general consensus is somewhere between 20 and 50 million deaths. Some research even suggests it could be as high as 100 million.
Okay, so before we get into the science, we have to talk about the name, the Spanish flu. It's a total misnomer, isn't it?
It is, and it's a fascinating lesson in media and geopolitics. It wasn't called the Spanish flu because it came from Spain. Most evidence points to an origin in the U.S., maybe Kansas, or even French military camps.
Oh, why Spain?
Well, during the war, the major powers, the U.S., Britain, France, Germany, they were censoring everything. Any bad news was suppressed to keep morale high, but Spain was neutral.
So their press was free to report on it.
Exactly. They were the first to report openly and honestly about how bad it was. They even reported that their king, Alfonso XIII, had caught it. So because they were the only ones talking about it, the world just assumed it must have started there or was worse there, and the name just stuck.
The disease travels on troop ships, but the news travels through neutral countries. That really sets the stage for what we want to do today. We're going to examine the permanent lessons from 1918. We're looking at three surprising areas: public health policy, the birth of modern scientific standards, and even the physical design of our buildings. Okay, let's unpack this.
So starting with the biology, this H1N1 virus was an anomaly. It probably came from poultry or swine and then mutated, which is typical for influenza. But the key was World War I. This massive movement of troops was the perfect accelerator.
It just spread it everywhere instantly.
All over the globe. You see it so clearly in the U.S. military stats. Something like 40% of the Navy and 36% of the Army got infected. More U.S. soldiers died from the flu than died in combat.
And the really strange part, the part that stands out to me, is who was dying. It wasn't the very young or the very old, which is what you expect with the flu.
No, and that's the tragic aha moment of 1918. It was young, healthy adults. People between 18 and 50 years old made up about 2/3 of all the fatalities.
How is that possible? Their immune systems should have been the strongest.
And that was precisely the problem. The leading theory is something called a cytokine storm.
Okay, break that down for us.
So, think of your immune system as an army. Cytokines are the chemical messengers that tell that army to attack an invader. But in a cytokine storm, the army just panics. It overreacts. The powerful immune systems of these young adults didn't just attack the virus, they started attacking their own body's tissue, especially the lungs.
So their own strength, their own robust immune response is what killed them.
It was their very strength that betrayed them. The symptoms were just terrifying, especially in that deadly second wave.
Right.
It would start with a sudden high fever, horrible aches, but in the lethal cases, there wasn't enough oxygen getting to the blood, so their skin would turn blue. That's cyanosis. And then came the hemorrhaging. Bleeding from the nose, mouth, even the ears. People could be dead in a matter of days, sometimes hours.
That biological horror, it leads you right to the policy questions, because they had no cure. All they had were, social interventions. And here, history gives us these incredibly clear case studies. The biggest failure, stopping those interventions too soon.
Absolutely. The tale of two cities in the U.S. just lays it all out. You have Philadelphia in September 1918. They knew there were 600 infected sailors in the city, but they went ahead with this huge Liberty Loan parade anyway.
They just backed the streets.
Attacked the streets. 3 days later, 635 new cases. In a single day, Philadelphia just collapsed. It had the highest death toll of any U.S. city, over 10,000 dead in that second wave alone.
Wow. And then you have St. Louis.
St. Louis. They had a similar parade planned, but the city officials, they made the tough call. They canceled it at the last minute and brought in strict social distancing.
And the difference was what?
Dramatic. St. Louis had fewer than 700 deaths in that same period. It's just a stark example of what happens when leadership prioritizes health over, public spectacle.
But it wasn't just about starting early, it was about keeping the measures in place.
Yes, San Francisco learned that lesson the hard way. They acted early, cases dropped, and they thought they were in the clear, so they held a big parade to celebrate.
And the flu came back.
It came roaring back a couple of months later. The protection you get from things like mask mandates or closing schools, what we call NPIs, it's transient. As soon as you lift the measures, if the virus is still out there, it's coming back.
So it sounds like there was no single silver bullet.
No, it was all about layering. A study of 43 U.S. cities proved it. The cities that did best were the ones that implemented interventions early, kept them in place, and this is key layered them.
So not just closing schools.
Right. It was closing schools and banning public gatherings and mandating isolation. That combination of closing schools and banning gatherings was the most common strategy. And the data is just crystal clear. The earlier a city did that and the longer they kept it up, the lower their death rate was.
So you have St. Louis on one end, early, layered, sustained, low mortality.
And on the other end, you have a city like Pittsburgh. They acted late, they did things one at a time, and they ended up with the highest death rate of all 43 cities in the study.
So moving from policy to the labs, the scientific community was just desperate. They were flying completely blind. No vaccines, no antivirals. They weren't even sure it was a virus.
They were in a dark room searching for a key, but they didn't even know what shape the key was. I mean, the main theory at the time centered on a bacterium called Pfeiffer's bacillus.
A bacterium?
Yes, it had been identified back in 1892, and scientists thought it was either causing the flu itself or maybe the deadly secondary pneumonia that killed so many.
So they were hunting a mosquito while an elephant was in the room.
That's a great way to put it. I mean, the bacillus was present in a lot of sick patients, so it made some sense, but there were huge red flags. They couldn't reliably grow it in a lab, they couldn't make animals sick with it, and they kept finding it in people who had completely different diseases, like whooping cough.
And that confusion just led to chaos.
Yeah.
A scramble for a vaccine.
Total medical anarchy. Labs all over the country, like William Park's in New York or the Mayo Clinic, were rushing out these quote-unquote vaccines based on that bacillus or other bacteria. The reports on whether they worked were contradictory because nobody knew how to run a proper trial.
Which brings us to those human experiments. On the naval volunteers, it sounds just unthinkable today.
It really shows you how lost they were. At places like Gallops Island, researchers tried everything. They took filtered washings from the noses of sick patients, which we now know contain the virus, and sprayed it into the noses of healthy volunteers.
And nothing happened.
Nothing. None of the volunteers got sick. So then they had sick patients breathe and talk right into the faces of the healthy volunteers, had them shake hands. Still nothing.
So that just made everything more confusing.
It deepened the mystery. It made them think they were completely wrong about how it spread or what it even was. They were just totally lost. But this raises an important question. All that confusion, all that failure, what was the positive outcome?
There was one.
There was. The realization that nobody could prove if any of these treatments worked forced the American Public Health Association to act. They issued a manifesto, and that document became the foundation for modern clinical trials.
A real game changer then. What did it say?
It laid out the rules we take for granted today. The absolute need for a control group. The importance of matching trial participants by age and sex. The rule that you have to test the treatment during the same phase of an epidemic. It was born from total failure, but it created evidence-based medicine.
And it took almost another century before they finally solved the biological mystery.
Right. It wasn't until 2005 that scientists finally sequenced the entire H1N1 genome from preserved samples and could say, definitively, this was the virus that did it.
Here's where it gets really interesting. How did a medical crisis like this permanently change the actual buildings and cities we live in?
The impact on architecture was profound because remember, they had no drugs. Good building design was seen as a primary line of defense.
So architecture was medicine.
Literally. In South Africa, for example, the pandemic directly led to their first Public Health Act and Housing Act, which set basic standards to fight overcrowding. And this led to a new design philosophy: sunny, salubrious care environments.
Salubrious, meaning healthy.
Exactly. Hospitals were designed with these huge, continuous verandas and balconies. The idea was you could literally wheel patients' beds outside into the fresh air and sunlight. It was all based on this idea of heliotherapy sunlight treatment that was popular for treating tuberculosis.
You can still see some of those designs today. But I guess there was a dark side to that, too.
There was a really unfortunate one. This community-driven health development often just reinforced segregation. New hospitals and facilities were built specifically for certain language groups or faith groups or racial groups. It hardened the social divisions that were already there.
And that model, the one with all the natural light and fresh air, it didn't last forever.
No. Later in the 20th century, the focus shifted entirely to efficiency. Architects started adopting the American idea of the health factory.
The health factory.
Think of a huge modern hospital complex like Tigerberg. The priority there is the separation of flows. Patients go one way, clean linen another, vehicles a third. And it all relies on mechanical environmental control, HVAC systems.
So they traded sunlight for sterile efficiency.
That's it exactly. The ideals of fresh air and natural light that came right out of the 1918 crisis were mostly sacrificed for this idea of a sterile, efficient machine for healing.
So what does this all mean? The lessons of 1918 are just. They're permanent. They're written into our policies, into our scientific methods, and literally into the bricks and mortar of our public buildings. The Spanish flu didn't just pass through history, it reshaped the world we live in now.
That's the real takeaway. The memory of 1918 is embedded in everything. And here's a final thought for you to consider. Think about that health factory, Tigerberg Hospital. Even as its design was pushing for maximum scientific efficiency, the entire intricate program had to be duplicated side by side to comply with South Africa's racial segregation laws. So even as medical science was progressing, social division was actively compromising the built environment. So I'd ask you to think about a major building in your own community. Does its design still reflect some of those conflicting priorities or even historical inequalities from a century ago?
A truly sobering thought about the hidden history all around us. Thank you for joining us for the deep dive.